My name is Carly. I have been a participant for the IBS-D study for the past few months. I first found out about it at the back of the toilet door at my local hospital when I was going for a physio appointment for something else. It really interested me because I have always had problems with my stomach or my bowels ever since I was a teenager. And it was always just a case of, oh, you've got IBS, you've got IBS. It's just watch what you eat. You'll be fine, you'll be fine. I haven't been involved with any medical research trials or anything else prior to this. This was my first experience. I'd never thought to sign up to anything else, but I just literally saw the poster and thought, okay, it's worth a shot just to see what the situation is and, you know, what other treatments out there could be possible for me, because this particular problem of IBS-D, you know, there isn't masses to cure you as such. I would say being involved in the trial has had a massive impact on my personal health. You know, I was very lucky to have the medication, or, you know, have the substance or whatever you want to call it, in the blind phase, and it worked pretty much within 24 hours. So from going to the toilet about 12-15 times a day to twice a day was huge for me personally. It also meant professionally, from a work point of view, I wasn't having to go to the toilet all the time, which was great. What made me want to sign up to this study as opposed to other studies was because it was a virtual study and I didn't have to travel anywhere. I could, you know, do it from the comfort of my own home and fit it around my schedule. If this trial was not virtual, it probably would have been not possible for me to get involved, as I live hundreds and hundreds of miles away from Newcastle. It wouldn't have fit around my busy lifestyle, you know, working full time. I've got 2 young children, a dog and a cat, and a husband to go with that. There's no way I would have been able to travel backwards and forwards, or, you know, take part if it wasn't virtual. So it made absolute sense for me to go for something virtual. And just having the reminder text messages, you know, to fill in my diary was really useful as well, because it meant that, okay, if I was busy doing something, okay, it's 6:02 now, I've got text message, I need to fill this in now, which was really, really useful. But also having the regular calls, the video calls with Hazel and the team and the professor has really been good, because it's meant that I don't have to leave my house to do this. So it's had such a really positive impact on me, and it's something that I would, you know, going forward, I would definitely do it again. So I think it's really good that we can reach a wider audience of people through doing a virtual study. I think it's something that's definitely needed, and I think going forward, it's definitely going to change the way that people take part in research trials. I think it's really valuable, and I think it's something that for the healthcare system, it will be fantastic.